Today we have an excellent panel who come to represent LUNEX. We are here with Professor Roberto Meroni, Head of Department in Health, Associate Professor in Physiotherapy. And we are here with Professor Kim Buchholz, Assistant Professor in Physiotherapy. And we are here with two fantastic students, which are Roxanne Pesnek, Master Student in Physiotherapy, and Matisse Wakil, Master Student in Physiotherapy. So now we are going to start this free seminar entitled From Science to Care, Building Tomorrow Health with Physiotherapy. So at the end, we are going to have a question and answer section where you could add questions directly to our panel. So don't be shy and write if you have any doubts. And now, Kim, the floor is yours.
Thank you so much, Victoria. All right, so I'm going to just give you a brief overview about physiotherapy. So I'll start off and then Roberto will continue and explain a little bit more about LUNEX. So the first thing I'm going to just speak to you about is what is a physiotherapist? So what is our job? What is our role? Where do we fit into the healthcare system? So physiotherapy is a profession with quite a broad scope of practice. So we work across a lot of fields, musculoskeletal, about the joints of the body, the nerves, the muscles, the bones. We also work in neurology, where you look at injuries of the brain, of the spinal cord, of the peripheral nerves running down into the arms and legs. Cardiorespiratory, where you treat the heart and the lungs of the body. Women's health, where you're treating women post-pregnancy, for example, where they might have injuries related to the birth. We also treat children who might have genetic disorders or who might have been injured at some stage. So we really have a very broad range of skills, primarily using exercise-based therapy, but also manual therapy, where we use our hands to help and treat those patients to allow them to return to full function and to be able to live life with the best quality of life that they possibly can, even if they continue to have disability. Okay, so we have a definition according to the World Physiotherapy, which is our global body that guides physiotherapy or physical therapy in all the countries in the world. So physiotherapy is a protected profession, a protected title, where to be called a physiotherapist, you have to meet certain criteria, and only people who meet these criteria are able to be accredited as physiotherapists or physical therapists. The name depends on the region that you work in. So according to our global body that monitors physiotherapy in the world, we are able to and required to be able to assess patients. So be able to have a conversation with the patients, find out what their problem is, find out what symptoms they have, and then make a decision based on those symptoms as to what we need to do with them. So we're able to form a diagnosis based on the assessment. We're able to come up with a prognosis, which is to decide how long it might take for the patient to get better, how much better they will get, because some of our patients might not necessarily improve fully, but we want to maintain their quality of life, and to create treatment plans. And then we also are able to refer them to other healthcare professionals or to provide the treatment program ourselves. Okay. So there are four main areas that we kind of fit our treatment into. So often people really recognize physiotherapy in terms of rehabilitation. So we treat people after an injury or when they've been sick or when they're in hospital. So for example, if someone's hospitalized for a long time, we will treat them when they're in the hospital to try and make them improve and recover their function. And I think that's what many people recognize physiotherapy as, or someone who has an injury, that they've injured their knee, or they have to have a surgery like a joint replacement. But there are a number of other places that we are very valuable within the healthcare system. And the one is that we can be involved in managing modifications to either people's occupational situation. So where people work, in the environments in which they work. So if they're having pain related to their computers and the setup of their computers, we're able to go and do an ergonomic assessment and then adjust their position and change their chairs and change their keyboards and to reduce the pain that they may be having from the situation. Or patients who need home modifications. For example, if someone's had a hip replacement, they need to have chairs that are higher, so they can't sit in very low chairs, and we can assist with that type of thing. We're also involved in health promotion. So we want people to improve their health in general. And there is a lot of evidence to show that exercise and physical activity and being active can actually change our quality of lives and improve our health. And it's also in disease prevention that we're able to slow down the rate at which people get disease. We're able to prevent certain diseases, all primarily using physical activity and movement and exercises to reduce their risk of getting diseases like cardiovascular disease, so disease of the heart, or diabetes, sugar sickness, people call it, or other examples, cancer, breast cancer and colon cancer. We can reduce the risk of those with exercises, for example. So physiotherapy has a very strong role to play in these sections, especially as we have populations that are getting older. So globally, people are living longer, and we need people, if they're going to live into their 70s, 80s, and 90s, to be healthy during those years and not be people that are relying heavily on the healthcare systems. Okay, so a little bit about what we do. So we work a little bit like detectives in physiotherapy, okay? We have to add up a whole bunch of bits of information and try work out what's wrong with our patient. And the first thing that we use to do this detective work is we look for signs. And signs are the things that patients show us when we assess them. So there's something we can measure. So maybe when a patient lifts their arm up, they can't lift their arm up fully, so we can measure how much range they have lost in the injury. Then we also assess their symptoms, and their symptoms are the things that they complain about. For example, pain, that they have pain, or they have stiffness when they wake up in the morning, or they have maybe they can't move their joints as far as they want to move their joints, or maybe they can't walk as far as they want to walk. So those are symptoms that patients report to us when we interview them. Then we take those signs and symptoms and we integrate them with our knowledge. So what you would learn if you came to LUNEX would be to understand the anatomy of the body and how different parts of the body can cause pain in different areas. We would also teach you how to recognize certain patterns of diseases and dysfunction so that you're able to actually decide what problems your patients have. And we teach you different methods of diagnosing your patients. Okay, so you integrate the information that the patient's given you from their signs and symptoms with the knowledge that you gain from your training. And we combine that with the evidence that we know exists, which exists from research. So physiotherapy is what we call an evidence-based practice. We use evidence-based practice, which is that we use the research that has been performed by physiotherapists and other medical practitioners and other researchers to come up with the best possible solution for our patients. So once we've made this diagnosis of our patients based on our signs and symptoms and the knowledge that we have. We then look at the evidence for those types of conditions, and then we are able to come up with what we call a differential diagnosis. And a differential diagnosis is usually we have one, which is the primary diagnosis of what we think is wrong with our patients, but then we also have potential other options that if it's not the first one, maybe there's a second one, but we always, by the end of the first assessment, have some idea of what the patient is suffering from. Okay, and this is the analytical part of physiotherapy, where you have to be able to put all these different pieces of the puzzle together to come up with your diagnosis so that we are able to create a treatment plan for our patients. Okay, so that's a very brief overview of what physiotherapy is in terms of its definition. But physiotherapy has a lot of options in terms of where you possibly could work. So if you want to work with children, you can work in pediatric physiotherapy. And there are lots of options here. You can work with children who are born with genetic conditions that right from birth, they might need to have treatment. There are also children who get sick. So, for example, a child with bronchiectasis, which is a respiratory disease, you might be treating that patient. You might be treating a child who has been injured at some stage. And this all falls under pediatrics, and you can become a pediatric physiotherapist. If you have an interest in sports, you could work in sports physiotherapy. And there's lots of ways to work in sports physiotherapy. And one of these ways is to have a private practice, like a private cabinet, where you are able to see patients who have sports and orthopedic conditions. And they would be treating individuals as they come through the practice. You can also work with sports teams, and you might land up traveling with different teams. You could travel permanently with a team. You could travel just for short periods of time when they perform at competitions, for example. Or you could be doing research in sports. So, for example, the picture in the top right of the corner is research in cycling physiotherapy. Okay. Do you want to work in a school? So schools also have physiotherapists who work at their school. And this could be in schools that provide services for special needs students, or it possibly could be a school that is providing physical activity for the students, for the children. And as you see, there will be lots of different environments in which you can work in a school with younger children, with very small children who need more one-on-one care, or in children where you are dealing with bigger groups of children. And is your interest working with older adults? So especially here in Luxembourg, we have a lot of physiotherapists who work with older adults, both helping them recover from surgery, from injuries, from illness, but also in maintaining their lifestyle and helping them to remain physically active and as independent as they possibly can. In a hospital setting, and you'll see there's lots of physiotherapists working in the hospitals, they can be working in different wards. For example, the intensive care units. And in the intensive care units, sorry, one moment. In the intensive care units, they could be working with patients who are ventilated, so they're not able to breathe properly. Maybe they're not able to move out of bed, so you're helping maintain their range of motion. During COVID, it was exceptionally important for the physiotherapists to help the patients recover from their respiratory disease and to help them recover following their hospitalization in the intensive care units. Okay, so we have a number of different environments in which the physiotherapists can work. So I've explained a few environments like hospitals, like sports clubs. There are, sorry. Sorry. You can have community settings like private healthcare centers where you might be running disease prevention programs, for example. You could have physiotherapists working in prisons that help to keep the prisoners healthy and provide them physical activity, provide them care post-injury. Sorry. Very commonly here in Luxembourg, we have physios who are working in the rehabilitation centers. So after your patients are discharged from hospital, they then will be moved to a rehabilitation center for a few weeks to allow them to recover from the surgery and to teach them how to live at home on their own. So if you don't necessarily want to work with patients, that doesn't mean that you have to work, that physiotherapy is not the profession for you. Okay, you can be a researcher, so you can do research looking at clinical conditions. You can try to find out the better ways for us to treat patients and to make sure that they get better quickly. You can do what I do now, which is that I'm a teacher. So I'm working in the university, teaching people how to be physiotherapists. You could be managing a team in a hospital, which is really important, managing hospital wards with physiotherapists, providing healthcare, providing education to the students going through the hospitals is also a really important environment for you to work. And supervision of students, it's something that we rely on very heavily when our students go out to do their training in the clinical settings. Or you can do a little bit of everything. So I'm using myself as an example over here, but when I first started working after finishing my bachelor degree, I worked in a private practice working mostly with sports and orthopedic patients. So they were coming post joint replacement, post injury. Maybe they were sporty, doing a bit of activity. And then I worked in an aquatherapy practice for a number of years. I did a lot of sports events where you'll see in the bottom right picture that we would go set up a tent and do massage at sporting events, different ones, cycling events, running events. In the top right corner, you'll see an example of our students from LUNEX doing massage at the ING night marathon. We assist there each year to provide massage to the runners who have finished the marathon or the half marathon. I also did a bit of touring working with the Australian blind cricket team. So we were lucky enough to go to India, which is why you can see the picture with the Taj Mahal in the background. I ran a private practice for 9 years, working with other practitioners, psychologists and massage therapists and dietitians. And then I moved into education and started working in teaching, initially part-time, doing my research, doing a PhD at the same time, and eventually moving full-time to LUNEX. So it doesn't really matter where your interest is. You can actually, it's a profession that's very adaptable, and you can change your job after your degree into whatever works for you. So you can work a little bit part-time, you can work in multiple settings. Up until 5 years ago, I always had multiple jobs doing different things, and now I'm much more full-time in one single setting. So it's entirely up to you and what you would like from the degree. Okay, I'm going to hand over to Roberta now to talk about why LUNEX.
Thank you very much, Kim. And now we are going to have Roberto with the next part of this presentation. Thank you.
Right, so good evening, everyone, and thanks, Kim, for the first part of the presentation. And I think it sets perfectly the stage, describing what with the range of activities that a physiotherapist can do, and also what you're going to be prepared for studying at LUNEX. So in a way, now you know the outcome, so what you will be trained for. And now let's talk a little bit about the, let's say, the training environment, the environment where you will be learning. So first of all, I want to start with the question, why LUNEX? Well, here you can see a few bullet points about some of the key aspects I think are worth mentioning. So first of all, LUNEX is relatively new in the scene. We were actually funded 10 years ago, so we will be celebrating our 10th year anniversary next year, actually. So we are going to have a year rich of events and celebrations for this first very important anniversary. So LUNEX is a modern and unique place in its way. Modern because of the year of foundation, but also, as you can see from this picture, is also a quite unique environment. So the LUNEX building is, for example, a former swimming pool that was actually renovated and adjusted as a training facility. And I think that in this picture, you can capture a glimpse of how particular also the environment and modern the environment is. And LUNEX is also an international environment. We have many nationalities represented across both staff and students. So it's a real multicultural environment. And it's located in Luxembourg, that is right in the middle of Europe, at the heart of Europe. So we are nearby several interesting hotspots. So Paris is very close by train. Luxembourg itself is very pretty to visit. We are close to Brussels, also Frankfurt. So it could also become a very nice starting point for exploring the heart of Europe if you want. In terms of what we provide to every student, we are very close in terms of student support. So we like to define that as personal support. And I think that our students later on can tell you more about the type of approach that we have with students in terms of students' life, student support, and student activities. And last but not least, the type of teaching style that we try to have at all times is very interactive. So we try to teach, for example, practicals in small groups to foster enough interaction between the instructors and the students, but also during the classical lecture style events, we try to engage as much as possible with students to keep the interaction as dynamic as possible. When it comes to LUNEX campus, we have LUNEX is dedicated to sport and health. And here you can see a very small sketch, a very short, small representation with the current state of the art of the campus, where we have LUNEX at the center, which is number 1. LUNEX is located in Differdange, which is a city in southern Luxembourg, around 35 minutes by train from the capital, Luxembourg City, that is the capital of the country. We are in the middle of the sport area of the city. So we have a stadium that we access for several activities. There is a sport complex that is currently finishing the renovation. So we'll have a brand new sport complex next door that we use for some practical sessions or for sport activities. And just across the street, there is a beautiful swimming pool facility with both an indoor and an outdoor pool facilities. And coming soon, we are expanding the campus with a new therapy center that will be hosting our physiotherapy students and students in dietetics, but also a student hotel, which is something that we are cooperating with the city of Differdange to create the possibility for student accommodations. Moreover, if you want to know more about the campus and how the facility is organized, you have here on the slide the QR code and the direct link for a virtual tour, a virtual 3D tour of LUNEX campus. So why physiotherapy at LUNEX? Well, I think we pride ourselves of being unique in many different ways. And here you have a few of the highlights, I would say. So first of all, the level of qualification that you will achieve at LUNEX is among the highest entry-level qualifications in Europe. So let me just spend a few words about the meaning of entry-level qualification. So as my colleague was mentioning, in order to be practicing as a professional in physiotherapy, you will have to have a license. You need to get certain credentials to practice physiotherapy. And these entry-level requirements varies across countries. And recently, Luxembourg set the higher standards in Europe for becoming a physiotherapist, which means that once you achieve these highest standards, it's going to be relatively easy to have your title recognized elsewhere. Because, for example, in Italy, the entry-level qualifications are set at the bachelor level, so 3 years of education. So by achieving your entry-level qualification in Luxembourg, you will have a higher diploma, a higher degree, and also being better also equipped to practice the profession. As my colleague was saying, physiotherapy is very much grounded into evidence-based practice, and this is our mantra. So we strive to provide evidence-based teaching and practice in every session that we teach at LUNEX. In terms of the possibilities of specializing in the field, we provide the entry-level qualifications with a combination of bachelor and master degrees, and I will be talking more about the two programs in a moment. But also at the end of the master degree, you will complete a level of specialization in musculoskeletal disorders, which is one of the new elements that we added after the latest accreditation of our master degree. And I will be spending a few words about that in a moment. I already mentioned the multicultural nature of the institution that span across both staff and students, and I'm sure that our students will tell you more about the multicultural environment from the student perspective. So what I can say in terms of the staff, from the staff part, is that at LUNEX you have the opportunity to engage with instructors that are coming from different countries worldwide. So we will have a very nice perspective with a very diverse viewpoints on the profession. We have colleagues from Europe, for example, from Italy, Portugal, France, Iceland, and also outside Europe, like Nigeria, South Africa, and beyond. In Brazil, actually, we have several colleagues that are coming from Brazil as well. So it's a very diverse environment. So this multiculturality, I think, is one of the biggest assets that we have. In terms of internship hours, you will acquire a minimum of 1,125 internship hours with opportunities to get more and more experience throughout your education with additional internships that are considered in depending on the various pathway they will choose in terms of your study career. And I think one of the another big asset that we have is our internship provider network, which is counting 200 plus internship providers. Many of them are located in the greater region meaning Luxembourg, France, Germany, and Belgium. But also we have partners across the whole continent in terms of Europe, but also beyond Europe. We have internship opportunities outside Europe, like in South Africa, Senegal, Rwanda, and even in, for example, some European territories that are overseas, for example, Martinique, French Polynesia. Some of our students had their internships in Australia and in Asia as well, in several countries of the Asian, let's say, territory. And last but not least, all our lectures are taught in English. So let's approach a little bit how your study plan is organized. So the first step in your education when you engage in physiotherapy at LUNEX is the bachelor degree. The bachelor degree is a 3 years study program over 6 semesters, 180 CTS. It's based on internationally recognized standards in terms of credit systems. And of course, as any academic program at LUNEX is accredited by the Ministry of Higher Education and Research in Luxembourg, which means that it's also recognized as such by other European countries. During the Bachelor, we basically lay the foundation for your education. So you will engage in practice-oriented teaching to prepare for your future task, and you will acquire basic elements of physiotherapy, such as anatomy, physiology, pathology, then engaging in kinesiology and how these topics are applied in various aspects of the profession, such as clinical assessment or treatment methods. And starting from this foundation, then you will be prepared for what follows, which are the master studies. Just to provide you a brief overview about how the 3 years of your bachelor degree are organized, in the first year, you are going to get mostly like foundation or fundamental elements of that are necessary for developing your skill as professionals. So we start with semester 1 with some foundations for successful study and practice. You will see that directly from semester 1, we start with introducing research and evidence-based practice in physiotherapy. That is one of the main pillars of education at LUNEX, followed by scientific foundation and the first module that is hands-on, where you will be learning musculoskeletal anatomy and physiology with your very first practical module, where we'll be starting to learn how to identify, for example, anatomical structures by using palpation. The following semester, you will be starting to develop some key skills in physiotherapy that are necessary, for example, for the assessment or for patient handling. And you will be diving a little bit deeper in human anatomy, for example, with human organs, but also exploring physiology and pathology concerning human organs and human movement sciences. The second year is where you will be starting developing some of your hard skills in physiotherapy when it comes to assessment in various contexts. For example, like in musculoskeletal pathology, cardiorespiratory pathology, or neurology and neuroanatomy. At the end of the second year, you would have acquired all the necessary foundations to start engaging in your clinical internships, in your clinical rotations. So the final year is mostly dedicated to your clinical experience outside the institution, where you will be put into a real context in practice what you learned in terms of theoretical knowledge, but also practical knowledge and practical exercises in the first 2 years. After successfully completing your bachelor, it will be time for you to start with your master studies in order to achieve your entry-level qualification for the profession. The aim of the master is to hone your skills and to upscale your knowledge and abilities in order to be better prepared for the work on the field. So you will be strengthening your knowledge in the field of musculoskeletal disorders, cardiorespiratory disorders, or neurological disorders. And on top of that, you will also acquiring a level of specialism in the field of musculoskeletal physiotherapy. This is how your study plan would look like for the first year. And we will be starting semester 1 with strengthening your ability to reflect and to critically reflect on your professional skills. Again, very important, we will move a step farther in your ability to understand how research and evidence-based is practiced in healthcare. And directly from semester 1, you will be starting with this stream for the level of specialism in neuromusculoskeletal disorders, followed by another module for more oriented to neurophysiotherapy. Second semester, we are completing part of your skills in the field of evidence-based and research, and adding another layer of specialism for what concerns the neuromusculoskeletal physiotherapy, focusing more on the lower quadrant. For example, on your lower back, hips, knees, ankles, and foot. These are the areas where you'll be specializing during the first year for what concerns the neuromusculoskeletal diseases. The first year is completed by another internship, another round of clinical placements, plus workshops in the field of lymphology. Finally, the second year, which is your fifth year and final year in your education, you will be completing your level of specialism in neuromusculoskeletal disorders at the beginning of the second year with the upper quadrant. A module for further exploring the field of pediatric physiotherapy, as well as cardiorespiratory physiotherapy and internal medicine. And during the last semester will be time for your last clinical placement and, of course, your final master project that will complete your master level education. So I think we had discussed a lot about the content of the studies to provide a sound overview of what you will be getting. I think it's worth also mentioning a few things about the how to attain a professional license. I think it's important for anyone who wants to engage in a period of study abroad, and that's probably going to answer some of your questions. So what will I be able to do after achieving the master level qualification? So based on the European regulations, after you, local and European regulations, after you achieve your entry-level qualifications in Luxembourg, you will be allowed to work as a physiotherapist in Luxembourg. Subsequently, via European recognition processes like the European Professional Card, you will be able to apply for recognition of your title in other European countries. And I want also to conclude this part about education with this very nice testimonial of one of our alumni that you can also find on the website, that I think summarize very well what we try to provide at LUNEX in terms of availability of the staff, availability of the teachers and all the instructors that are available at all time for students. But also the type of experience that you will have in this diverse environment, and also thanks to the clinical internships that are provided. Just a few words about Luxembourg. I think this picture summarizes very well the nature of Luxembourg, meaning that it's a nice combination of tradition and, for example, this is a picture of the city. And you can clearly see the contrast between the, let's say, the historical part of the country and this new and dynamic part that is seeing the country now with a massive expansion. So I came in Luxembourg 5 years ago, and I'm always amazed by the amount of improvements that the country has done and the developments and how things have changed in this in such a short time. So for the admission procedure, here you have some key points. Basically, you apply online. There are some documents that you have to send, and the website will guide you through the entire process. There is an application day, and surely our students will be more than happy to elaborate on that, because that's something that they answer from the perspective of prospective students almost every day. And then there is all the procedure for signing and returning the study agreements. And we accept new students in October and April. So I think that is very important. If you decide that you want to engage in this type of education, we accept new matricles twice a year. So you can apply at any moment in time, and you will be able to start with your first semester either in October or April. And then you have some few bullets on the tuition fees and everything that concerns payment of study fees. There is, of course, the possibility to recognize prior learning and experience, and that is another process that I can explain you more about if you have specific questions about that. And of course, for all information, our student recruitment is always available to answer any question. All right, I'm done with my part of the presentation, so more than happy to answer any question that you might have, and handing over the floor to our students.
Thank you very much, Roberto. And now we have the testimony of our students.
Hi, hello, I'm Matisse. I'm a master student in physiotherapy.
And I'm Roxanne, also a master's student in physiotherapy.
So we have our students in master, but we did also a bachelor here in LUNEX. What we can tell about LUNEX, it's really a small community inside LUNEX. We can really have access to teachers. That's the big point that I want to point out. We can really go and talk to teachers. I think that's an issue in most university. And we can really have easy access to teacher. I had contacts with Roberto and Kim previously when I had troubles in the module or just a question on an assignment, for example. So this is really a great thing, I think, about LUNEX to the communication with the teachers. Roxane, if you have something.
And also what is nice when we are preparing for the placements is that we are fully supported throughout the whole process. So when we want to choose a placement or when we kind of have questions about a patient or a certain pathology, we can always send an email to our teachers, and they are more than happy to help us in any time or any way during the process. So LUNEX, what we can say is that we are really helped by our teachers, and that is really different from other universities.
Also, to add more on the placements, so internships, what Roberto talked about it in his presentation. It's nice that we have a lot of choices of different placements and everywhere in the world. If you want to learn about how it's going, for example, in Cambodia, you can learn about it, or in South Africa, or stay maybe close in Luxembourg or France. And you can really we have a wide variety of placement all over the world, and I think it's really nice to see different types of organization.
Mm-hmm. Yeah.
And we do a lot of placements also, so a lot of hours of placement, and I think it's a great thing because real work that you can apply the theory that you see. The first, as Roberto said, he explained the year curriculum. You only go into placement in your third year. So the first 2 years and 2.5 years, if I could say, are for theoretical knowledge. And then after that, you have all your theoretical knowledge and you go into the placement, and you can apply this knowledge. But in difference to the students that I saw from other university or whatever, we came into the placement and we had a lot of knowledge compared to them. So we were really more prepared, I found.
Yeah, that's yeah. If you have any questions, you can let us know and we'll answer them, of course.
Thank you very much. I have already read a lot of questions in the Q&A box, so let's start with the first one. Sorry, 1 second. Okay. So the first question is, okay. Hello from Italy. I wanted to ask how difficult it's to make friends and be understood by local in a country as multilingual as Luxembourg.
So to answer this, maybe Roberto can talk about it because he's Italian.
No, you go first. You students.
Yeah, I'm going to talk about the student perspective. So here, everyone is speaking English to study here. So in the social way, you won't have any trouble to talk to anyone. And even in Luxembourg, everyone speaks really well English. It's impressive. So I don't think you will have troubles or some slight troubles with maybe old people that you might encounter that don't speak so great English, but you will find a way anyway. And to make friends, Kim, you want to add something? No, okay, sorry.
After you finish.
Okay, to make friends, we are also a part of the LUNEX Student Union, so the union of the students, and we are kind of helping people from all cohorts and especially new cohorts, new classes, to make friends. There's a lot of different types of events. There is, of course, parties that we organize. There is less less important events, such as, for example, game nights, board game nights, movie nights, those type of stuff. If you don't like parties, we can totally accept that. Don't worry. So to make friends, it's really a possibility. It's not so hard. If you some.
Yeah, I just wanted to add, there is an important component of the language that you do need to consider if you're coming here as an international student, is that to do your clinical placements in Luxembourg, you do need to speak one of the official languages, and that's French, German, or Luxembourgish at least a B2 level. But that's only if you want to do your clinical placements in Luxembourg. In France, you have to speak French to do your placements there. So it is something that you need to consider, that if you are an international student, you might not be able to do your placements here if you don't learn the language at the same time. You might need to go back to your own country or to another country. Maybe if you need to do them in English, we've got some placements in Italy that do English. We've got one in the Netherlands, one in Belgium. But I think it's an important thing to think about, because if you're wanting to do your placements in Luxembourg, then it would be a very good idea to start learning probably French primarily, depending on where you want to be, but the medical language in Luxembourg is French. So, you will, and we can assist you with courses and giving you access to courses to learn French, so that by the time you're in your third year, you will be at the kind of level that you need to do your clinical placements. But that's probably the primary language concern that we have with students, is not being able to do clinical placements in Luxembourg because they only speak English, for example.
I just want to add up on what Kim said. So, for example, we have examples of students that came to Luxembourg to study at LUNEX, and then they had their internships in Spain or Italy, because in terms of their education and the languages that they spoken, what we did with our placement network was to find throughout the network suitable placement opportunities for them in countries where they could engage in meaningful clinical activities, such as, for example, in case of a student who speaks English and Spanish, or English and Italian, and so on.
Thank you very much. Another question is, how is the pay in Luxembourg for a starting physio?
How much are people getting paid as a starting physio? So maybe Roberto and Kim can bounce back on this if they know more. But from what we heard,
so in Luxembourg, I think there are two main things to consider in Luxembourg. So in Luxembourg, most of the physiotherapists are working as independent practitioners, self-employed. And that is because it's very specific for Luxembourg as an environment. So the healthcare system in Luxembourg is structured in a way that reimburses 80% of the physiotherapy sessions that the patients are getting. So in this sense, it's pushing towards this type of organization of the physiotherapy service. So in this sense, the pay can be quite high the more patients you treat. Of course, there are several factors to consider, whether you work for an already established private practice. So in that sense, you need to factor that you will be paying, for example, rent, because the private practice is not yours. So you're renting a space to work. In general, it's among the, based on the experience I have, is among the highest in Europe, but that is also normal in Luxembourg as well, because the cost of living in Luxembourg is generally higher than other countries in Europe. Just to give you an example, there are plenty of cross-border workers that are commuting every day from France, Germany, and Belgium, physiotherapists, colleagues that are working in Luxembourg because the pay is considerably higher from what they would get in their original countries.
And if you want, from what we heard from graduating students, range of price, from what we heard from friends we have that have graduated, it's between 4,500 and 6,000 euros if they worked in private clinics. So it's considerably high, I think. But as he said, as Roberto said, it's depends on where do you live, because living in Luxembourg costs a lot. So you need to see, but you have the price range if you wanted that.
Thanks a lot. Another question is, what is your course unique for? Something that distinguishes it from the same course in another university?
So, if I could say what's different from what I heard when I went into placement, there was other students from different places, from Europe mainly. What I say is that really is different in LUNEX that we build block by block, and we do not do all the modules, all the subjects in the same time. We build on one on top of each other, and it's complementary. It's continuous learning rather than just having all your classes for like 2 months and then you have a final exam, a week of final exam, and then you have all your exam and you just need to learn for the first day, then you need to forget all about it and then learn another topic for the next day. This I found when I talked with other students from other university in placement, I found this really not practical, and I saw what the difference was in LUNEX and the continuity of learning. For example, we do the first neurology module in the second year, and we do it again at the end of the second year. And so this is really continuous because you learn it, you implement it, you have time to think about it, really make it your own, and then you will rework on it and build on top of it. And this is really, I'm gonna say continuous again. That's the word I would say. That's the biggest difference, and I think it's really more practical.
Another thing that I can mention to answer that is, for example, now the level of specialism that our students will acquire at the completion of their master studies, that is not common in any other institution elsewhere in Europe. So typically you graduate with your entry-level competencies, but you do not have any level of specialism, or the course is not structured to provide you a level of specialism. Whereas at LUNEX, we decided to structure the 5 years education to provide a very nice and round education in general physiotherapy, covering all the physiotherapy areas, plus on top adding this level of specialism in neuromusculoskeletal disorders that I think is quite unique, and there are very few institutions out there that offer the same in terms of you graduate with the entry level plus the level of specialism. That's probably the main thing that comes to mind when it comes to uniqueness, aside from the other things that I mentioned in the representation.
And I think this is really a cool part, if I can say, because right now you might not realize what is neuromuscular physiotherapy. But for me, and I think for most students, is the combination of like adding two of the most interesting parts for most students together and to apply them to your practice and real practical usage of this. And I think it's really a great thing to have on top of your general knowledge, and you will get out of school, out of LUNEX with the something more than the other students. Yeah.
Thanks a lot. Another question is, how are the classes structured? How often will class take place? I don't know. I think they are referring about an hybrid mode, or how many students there are in a class during a lesson.
Well, maybe I can take this one from a more, let's say, structural viewpoint, and then I can let the students answer from their experience part. So as Mathis was mentioning, we teach in a semi-intensive block teaching structure, which means that we teach 4 hours per day, every day. So typically our students are getting 20 hours per week contact time, then depending on the weeks, but that's the average, which means that during the afternoon or the morning, depending on when the classes are organized, that's time for the students to consolidate. That's self-study time, working on tasks and activities that prepare for the following sessions. The block teaching method is basically an approach where you concentrate on one subject at a time. So you're not getting like anatomy on day 1 or physiology on day 2 and then something completely unrelated on day 3. You focus on a block that is consistent, that makes sense in terms of the continuum of learning. Then you have a short break, you prepare for the exam, and then you have the exam. After that, a new block comes, and it follows the same structure. So this way you do not have, like Mathis was mentioning, the final term exams period. You're basically taking exams as you progress. So it's a full-time commitment in this semi-intensive block teaching where it's a very nice blend between contact time, self-study time, exam preparation, and exams.
And what is nice also with all of this is that we can really make sure that we understand each subject and each part of the classes, because sometimes for international students, having classes in English can be, even if they have B2 level in English, it can be still complicated to switch between languages. And so they have the time to learn the new words and to integrate completely the different definitions and the different kinds of the different important parts of each classes. And even if we have questions to the teachers, we still have time to ask them. And before the exam, since we have some time to study, it would allow us to ask questions to the teachers, and they will have time also to answer us. So it is nice to have classes like this.
And also for time management, if you like to practice sports, maybe in the afternoon or in the morning, you can, if you have class from 8:30 to 12:30, you can take your afternoon to do sports or whatever you want, and then work in the evening if you want on the 4 required hours to work on your what you learned in the morning, or the opposite. You can arrange your day depending on what you want to do during the day, but you will need to study anyway, but you will figure it out at one point. But yes, you can time manage really well. That's nice.
I see a linked question from Ekaterina. So is it that it's necessary to recognize the diploma? I guess that if you mean your high school diploma, if you're coming from outside Luxembourg, there is a process during the application that requires you, and our recruitment office will guide you for that. There is a process for recognizing your diploma, and Mathis can explain that.
We can explain this. So to have your diploma recognized, your high school diploma, if it's this, you will need to send it either translated in the national language of Luxembourg, so either in French, German, or Luxembourgish. You need to translate it, and then you need to send it to us, and then we will do the recognition. The process of LUNEX will do the process of the recognition. So they will just ask you to sign some documents to start the process of the recognition, and you won't need to pay anything because, or in English, your high school diploma, if it's in English, it's also good because for us, we're an English school. You can send it to us, and in your fees, your entry fees, there is a part that's for your high school diploma recognition. So this is the process will be handled by LUNEX recruitment. And yeah, either in French, German, Luxembourgish, or English.
Okay, so I think we have time for 2 questions. I don't know if you, Roberto, will choose which one do you think is the most useful?
I saw an interesting question about specific entry requirements for international students that perhaps Mathis and Sen can answer because I think that is relevant because that's quite interesting.
Yes, so for international students, so outside of Europe, you will need to do a visa every time, a study visa. So for this, the recruitment will ask you some documents. So of course, your high school. We will need. That's the new regulation of the Luxembourgish Ministry of Health of Higher Education. You will need to have bachelor diploma, even to start in a bachelor. So this is kind of confusing, but you will need to have previous bachelor, so plus 3 years of higher education. So university diploma, a bachelor diploma or 3 years of university to start in our bachelor or in our master if you want directly to join the master, if it's related. But yes, that's the main issue sometimes, that if you're just out of high school and you are international students, sadly, due to the law of the Ministry of Luxembourg, you cannot apply directly. You need to do 3 years of higher education study. After that, for the visa application, LUNEX helps a lot in the process. You will just need, I'll be asked to send all the documents that we need to verify your identity. And also you need to have already signed your study agreement that says that you will come and study at LUNEX, because the ministry needs to know that you have signed an official document that you will come in here and study. And also about the fees, you will need to pay the first year amount in advance. So for physiotherapy, it's a little bit about 10,000 euros.
And then the last one, I see that Didi asked 3 questions in a row, so I think we can condense them in one answer. So she's asking whether during the first year, if students are going to use laboratories, facilities, and which ones. So like I mentioned during the presentation, so from year 1, you're already engaging in practical learning. So you will have access to practical classrooms with treatment beds and all the necessary equipment to practice basic skills in physiotherapy. Then how many students find employment after graduating? And in terms of physiotherapy, we are pretty lucky because all of them, like Matthias was saying, reading his lips, all of them find work after graduation. In terms of finding work, you can only work as a physiotherapist after 5 years of education. You cannot work after only a bachelor degree. With a bachelor degree, there are still some job opportunities in terms of health offices and authorities, health insurance companies, healthcare suppliers, science and research, supporting sport clubs and associations, but not as a professional physiotherapist. You can still use some of your skills for those companies, but not as a therapist. And then finally, during the course, will there be counselors, tutors to guide us in our decision of what kind of physiotherapy path we want to pursue, like, for example, sports, older adults, and rehabilitation centers? I think that is a very good question. So in terms of the program at LUNEX, as per the accreditation, we basically provide you with a very round education on all these aspects to achieve the entry-level competencies, plus this level of specialism in musculoskeletal disorders. But at all time, like Matthias mentioned already, all the teaching team is always available to support students. We also have a very effective student support system. And then I leave the word to Kim.
So I just wanted to mention, during your bachelor degree, you will have to do clinical placements in musculoskeletal, in neurology, and in cardiorespiratory. So one in each. So you'll get your experience in the bachelor degree in one of each of those. In the master's degree, then you have a little bit more flexibility, and you can choose to do one of your placements in a private cabinet, for example, or a private practice for the non-French speakers. You could then go to like a sports practice or something that's a little bit more specialized, so that you have the opportunity to then experience the different environments. And that also assists you to make the decision about where you might choose to specialize after your 5 years.
All right, so
thank you very much for all the questions, and thank you very much to our panelists who answer of all of them, and also for your interesting presentation. I want to recall the fact that in the next day you are going to receive the recording of the webinar and additional material about LUNEX. So now I'm gonna send in the chat the link in order to receive the certificate of attendance of this event. If you have any technical problem, just write me, text me a message on our WhatsApp number. Okay, so thank you everyone, and I don't know if our panelists want to leave the participant with a final message.
So who's starting? Guys,
Yeah.
the two youngest first.
So don't hesitate to contact us, especially the recruitment. If you have any question about how to apply, something like if you have any other question on more boring things, maybe the application process, don't hesitate to contact us. And then if you want to see more about physiotherapy in general, if you are close to Luxembourg, don't hesitate to come to the open door days to visit LUNEX if you can. If not, you're gonna get the brochure that Roberto presented some part of the brochure, and with this you have a really great understanding of what all about physiotherapy at LUNEX.
And also on the website, you have all the information, and you also have the number on who to call, on what kind of email address you can send your questions to, and also where to apply, because you have to apply directly on the website.
And you can apply whenever you want.
Yes.
Also.
Okay, I'll just follow up very quickly. I will try answer some of the questions that are there. I see Roberto's also been typing a few answers, so that we'll try answer some of the questions we haven't been able to verbally answer a little bit quickly, but please feel free to contact our recruitment team because they really can answer all of the questions that you've put in the Q&A, and we're really happy to collaborate with you and to see what we can do in terms of recognizing previous degrees, recognizing qualifications that you have done to try and integrate you into our system.
Perfect.
Yeah, I can only echo what Kim said. So for any question that we haven't answered, contact our recruitment office, and probably also Matisse and Roxanne will answer you.
Yes. If you have, I saw a question that someone said that she had 5-year experience degree. Yesterday I just did. I helped someone who had an osteopathy diploma. She wished to enter physiotherapy, so we can help you with this if you want equivalences to enter directly the degree at like a later stage. So don't hesitate to send it to us.
So thank you everyone, and have a good day. Goodbye.
Bye.
Bye, everyone.
See you
Have a
at
good
LUNEX.
night.